Hi, I'm Nick White. I'm a clinical psychologist working for Fareham and Gosport CAMS. When a young person is affected by anxiety, low mood, and other difficulties, it can feel incredibly hard to know what they may wish to change. They may have the experience of thinking, well, so many people ask me this question, and I just don't know what to say. As a carer, as a parent, as a professional, we may be very concerned about helping a young person to feel better, but feel stuck ourselves about knowing where they may want to be in the future, what would help them to feel better. Tuning in an effective way to what a young person values and what would give them the sense of returning to their valued life can be an incredibly important discussion to have when setting goals. It's helpful to start small. You may find that what you're looking to do is to set small goals that are very specific and actually take place over a short period of time to start with. What you can then do is be looking over the longer term as to what goals might be helpful in the future. When setting goals, it can be strange sometimes, but sometimes knowing what you don't want to happen can be an equally helpful question to ask. Equally, it can be useful to ask the young person about what they may see happening in 3 months' time, in 6 months' time. Moving it into the future can be a good way of trying to form some more details about what a goal might look like. It's likely that you will have very many goals to start with, but as a basic rule, it might be good to start with 3 rules. When working with a young person, you may find at times there are very many goals that get developed. So it can be helpful to try and limit yourself to start with. Again, which may seem strange, it may feel brilliant to have a whole range of goals, but in reality, the first steps need to be achievable. There needs to be a focus. So you might start with 3 goals. Write them down, put them in front of you, sit with them, see how they feel. Try them on for size, and then use that as your starting point, thinking that you might put the other goals to one side for now and support the young person to feel that you can revisit them at a later time. When a young person feels very stuck, it can be helpful to use wider ways of thinking with them about what they might want to achieve. One of the very interesting techniques that comes from solution-focused therapy is what's known as the miracle question. And it's very simple. You might sit down with a young person and say to them, can you imagine for the moment that tonight a miracle happens and the things that are troubling you disappear? What would you notice tomorrow? What would be different? And the key question there is about what would you notice? What are the specifics? What would have changed? Using these kind of questions can again help a young person consider the alternatives to the stuck situation they're in. They may be very small changes, but small changes can be a starting point. So, you've got some goals down on a piece of paper. What next? So it's helpful to consider what can be the smart way of these goals moving forward. So the first part of SMART is specific. These goals need to be something where they're very clear. What would it look like if you've achieved the goal? What would be different? How would someone be behaving? How would they be feeling? What would happen differently in a situation? The M is measurable. It's incredibly important to think with a young person, well, how will we know if we're making progress? How do we know if we're working towards where you want to be? You could use a rating scale. You could use something visual. You could colour something in. You could keep a track on a phone. There are very many alternatives, but the key thing is to help represent progress, and that if progress in the young person's mind isn't being made, that you've got some indications of that, so you can take a step back and say, maybe we need to change this. Maybe this needs to be a different goal. The A in SMART stands for achievable. Goals need to be feasible and attainable. A golden rule might be to consider that a goal can be out of reach but not out of sight. If the goal is too far ahead, if the goal feels too intimidating, a young person will lose motivation and won't see it as something that they can reach, something that they can get to. The R in SMART stands for realistic. Within reason are the skills, the resources, the time frame that you have available to you going to allow the young person to achieve that goal. As we mentioned before, what can be very difficult is if something feels as though it's going to be too great a drain on resources. If it's not going to be realistic, motivation will be lost and the young person's difficulties will remain. Lastly, the T in SMART stands for timely. It can be very important to set realistic timeframes for the goal you're trying to achieve. Aim too far ahead and motivation can be lost. Make it too soon and anxiety may be overwhelming and be a huge barrier to that goal being achieved. The key thing is collaborating with the young person. What's going to give the right amount of pressure to help the young person be motivated but not be too overwhelming and become a barrier. So once we've decided on our SMART goal, once we've decided on the time frame for the goal with the young person, it's incredibly important to monitor it on an ongoing basis. There is a danger that a young person can quickly become disheartened, can feel that things simply aren't achievable. And if you're not monitoring how things are going, you may simply notice the first sign is when they withdraw, when the goal is no longer something they're interested in pursuing. It may be helpful to have some additional rewards in the mix as well, to think about what could be an extra motivator in helping them move towards their goal. And again, this may be very helpful to start with, but you may find overall as they move through their goals that what can be useful is that actually just the sheer achievement they feel themselves will be a motivator. As we mentioned earlier, you may come up with very many goals together. And one trick can be thinking, well, actually, if we were to rank these on a top 10, what would be our top 3? What were the top 3 most important goals to achieve? Finally, it can be incredibly important that these goals remain collaborative. A young person can quickly become disheartened if they feel that they're being left on their own to achieve a goal they may feel is unattainable and being judged for their progress. So if they realise they've got their own strengths and resources to call upon, but also the strengths and resources that are around them, they may feel more confident that ultimately they can reach the goal that they value.